Hi, my name is Sheila Wilson, and your name is?
Mary Morengo.
Mary, and you're here with your sign, Stay Staffing Now, St.
Yes.
Vincent's Hospital. I hear horns honking and everything else. Why are you, as a nurse, striking?
Because it's the only way I know to get tenant to pay attention to the fact we need safe staffing. And we knew that it was going to be a problem after question one. We lost that for the ratios.
Oh, yes.
So we had a feeling that it was going to get worse, and it did. It got drastically worse.
Oh, wow.
And I work on a psychiatric unit.
Oh, wow.
And I'll tell you, the main reasons patients come to us is so we have time to talk to them. And when you can't, it's not only just bad care, but it gets unsafe. As a matter of fact, I think there was an article in the Worcester T&G about a patient who got assaulted by another patient.
Oh, yes.
Just last week, and and he also, I heard, said to one of the replacement nurses that he had the wrong meds in his cup, and instead of asking him, "Oh, let me go check," she yelled at him and said, "You don't question us," so which is not what we do. You know, our patients know us, and we make sure that we have a rapport with them, and that's why they come. It's to get the interaction with the nurses they know, plus the fact that they've been cutting staff, and they actually expanded the unit, and they haven't added staff as well. So that's why because I've been doing psychiatric nursing for 40 years. I used to work at Westboro State Hospital. So I do know that you need a community. A lot of patients now, because there's no real access to care, and the state hospitals are closing, they just come. We have recidivism. We have the same patients now coming to the general floors. So, we need
On the general
good
floor,
care.
are they with sitters?
Sometimes, but not always.
Wow.
And I don't know what they're doing with the sitter situation. I know they're always trying to decrease staff. So that's a big problem. And I know that they even say that instead of sitters, they're going to make the current staff that are there cover all the one-to-ones and things, so that there's even less staffs available for the other patients.
What has changed for you as a nurse since all of this big commotion?
You mean since the strike?
Yeah.
Well, since the strike, instead of being inside, I'm out here. I mean, I'm trying to educate people, and trying to make sure that when we go back in, we have the staffing we need to take care of our patients. I mean, I love my job. I've been doing this for a long time. So this is,
Have you been in psych for 40 years?
I've been in psych for just about 40 years. I've been a nurse since 1978. So
Wow.
I've done other things, but I've been doing this a long time. And over the years, what I've seen, since profit-driven hospitals and for-profit corporations are monopolizing the healthcare, is that our patients are a way for them to make money. And not paying staff is another way to make money. It has nothing to do with the care that we provide. I mean, there's a lot of euphemism around it, but basically we wouldn't be out here if the care we could give was what it should be,
Right.
So
Right. I've heard that a lot.
yeah.
Well, thank you, Mary.
All right, well, thank you. I appreciate it.